Welcome back. So, we are starting with lecture 4 in this module 12. In lecture 3, we have looked at autism spectrum disorder and dyslexia, developmental dyslexia. Now, we will look at some symptoms of language disorder with respect to Down syndrome. Now, Down syndrome is yet another well studied and well known disorder, that is a developmental disorder. Down syndrome is one of the most common genetic cause of intellectual disability. This is found approximately 1 in 700 live births. This is a statistic that we have got from Center for Disease Control and Prevention. This is 98% cases of Down syndrome are caused by an extra copy of chromosome 21. Actually, this is Down syndrome is primarily a genetic disorder because of certain malformation of the genetic material. We have this particular outcome. So, one of them is, of course, there are many other reasons, but one of them is that is actually this is very prevalent. 98% of the cases of all Down syndrome patients are caused by an extra copy of a particular chromosome. And this can occur in any race, socioeconomic status or geographic location. This is prevalent across the world. The only etiological factor undoubtedly linked to Down syndrome is considered to be increasing maternal age. So, this is something that this correlation has been reported by one particular study, that there seems to be a direct correlation between increasing maternal age and Down syndrome. Now, Down syndrome is, though it is primarily a genetic issue, there are many problems that you will see concurrently. There will be hearing problems, there will be language related problems and other. So, we will take up one by one. Hearing skill problem is very common among Down syndrome children. Approximately 2/3 of children with Down syndrome experience conductive hearing loss, sensory neural hearing loss or both. So, hearing loss is a problem which is quite common with respect to Down syndrome patients. Otis media is one cause of mild to moderate fluctuating conductive hearing loss. This is one of the reasons for this kind of hearing loss, and this is found very often with children with autism, children with Down syndrome as well. So, they may be particularly susceptible because of the narrow auditory canals and cranial facial differences. Down syndrome children, Down syndrome persons have a very particular kind of facial structure, which probably has which leads to narrow auditory canals and cranial facial features. So, because of which they might be more susceptible to Otis media, which is the underlying reason for hearing various kinds of hearing loss. So, this is the connection that have been proposed as a reason for the hearing skill problem with the Down syndrome children. They also have oral motor skill related issues. So, they tend to exhibit differences in oral structure and function. So, structural differences include a small oral cavity with a relatively large tongue and a narrow high arched palate. So, the structure of their the oral cavity is also different as opposed to the normally typically developing children. Missing, poorly differentiated or additional muscles also are part of their facial features. So, some muscles might be missing, some might be poorly differentiated, sometimes even additional muscles are part of their facial structure. So, these factors are considered for their poor speech intelligibility. So, Down syndrome children have hearing related issues, their speech is also poorly, it is marked by poor intelligibility, it is not very easy to understand, and that is probably because of the different kinds of muscular structure and the overall facial structure is different. So, that might be responsible for the problem. At a cognitive level, about 80% of individuals with Down syndrome have moderate intellectual disability, although some have severe intellectual disability as well, and others have IQ score in the average range. So, it is again a variable kind of a group Not everybody has the same level of cognitive disability. Some of them have average IQ, some of them have serious deficit in cognitive level. Visual spatial processing and perception are generally viewed as strengths. If you recall, we looked at Williams syndrome. In case of Williams syndrome, the visual spatial skills were seriously affected, but in case of Down syndrome, that is not the case. They often have this is one of their strengths actually. Even though they have their cognitive abilities or other cognitive abilities may not be at par, but visual spatial processing and perception are almost intact in most cases. Some cases it might be different again. Social skills again, children with Down syndrome are typically characterized as highly social, engaging and affectionate. So, they are this is where there is a similarity between Down syndrome and Williams syndrome. Williams syndrome children, we have seen that they are characterized by being very talkative, very sociable kind of people, cocktail party personality. Down syndrome children are not called cocktail party personality, but they are also highly sociable as opposed to autism spectrum disorder. So, autistic children typically tend to be limited to themselves. They are very they don't open up, they don't have social skills as such, but Down syndrome children do. So, these are the differences and similarities across disabilities. Socialization and daily living skills appear as their strength compared with communication. Children with Down syndrome form interpersonal relationships in much the same way as a typically developing child. So, just the way other children will be making friends and engaging in social activity, Down syndrome. So, in this scale, they do not show any serious disability when you compare them with the control group. Now, we will look at the language learning abilities. So, as with many other disorders, Down syndrome children show more impairment in expressive than receptive learning skills, which is common, which is not only common across disorders, but also in terms of normally developing children also. This is seen at a particular stage, that difference remains. Children with Down syndrome have poor speech intelligibility than younger typically developing children of similar nonverbal mental age, not chronological age, but when you match them with mental age matched control groups which are younger to them, because their mental age is less than their young chronological age, then they seem to have a poorer speech intelligibility. Some of the phonological processes like systematic sound error and simplification patterns continue for longer time than their MA matched controls. So, for example, small children often make very simplified sounds. We have seen it in our phonological chapter, where there are certain kinds of simplification that children follow. For Down syndrome children, those simplifications and those errors continue for a longer time as opposed to their controls. In terms of receptive vocabulary, there is a level of contradiction, because some studies report poor receptive vocabulary, whereas on the other hand some studies do report very good receptive vocabulary, good in the sense that they are comparable to neurotypical children. So, there is a bit of a contradiction there. We have results from both perspectives. Similar contradiction is found also in the expressive vocabulary, though quite a few studies have reported that their proficiency in expressive vocabulary is poorer compared to their mental age matched controls. So, expressive vocabulary, in case of receptive vocabulary, it seems they are generally you cannot bracket them in any of the categories. So, the contradiction is kind of balanced, but in case of expressive vocabulary, more studies report that they are not at par with their MA matched control groups. In case of syntax, so vocabulary and phonology we have seen, now we are moving to syntax. In syntax, several studies have shown that syntax is more impaired than vocabulary in both receptive and expressive domains. So, in case, though the studies in case of vocabulary are have reported contradictory findings. In case of syntax, there seem to be more consensus that their syntax in both receptive and expressive domain are quite seriously affected. For example, there have been many studies, the literature, we have adequate literature on Down syndrome children's linguistic repertoire. One particular study reported a group of 31 boys with Down syndrome produced less complex noun phrase, verb phrase, sentence structure and less complex questions and negations. So, in all of these domains, so both noun phrase, word phrase, sentence structure and as well as complex question and negation. So, in all of these important domains, their production in terms of syntactic structure was comparatively much less complicated. So, they tended to use simple sentences. Overall, some children with, if we have to summarize, some children with Down syndrome are competent with language skills, however, most are not. There are reports, enough reports of children with Down syndrome doing pretty well with the language skills. However, larger number of reports have been coming from those patients who are not really good. The initial stage of language acquisition, that is 0 to 4 years, they seem to have comparable language acquisition with mental age matched controls, but lag behind in terms of the chronological age matched controls. That is the initial stage, but after that stage lexical and grammatical development also become very slow. So, in terms of vocabulary acquisition as well as in terms of the syntactic acquisitions, both in receptive and expressive domain, grammatical as well as vocabulary, they tend to become slow after a period of time. So, in the initial stages they seem to do well, but later on there is a slowing down. So, this is about our Down syndrome language related problems as far as Down syndrome goes. Now, no discussion on atypical children will be complete without focusing on little bit attention on the intervention methods. Of course, we will not be able to give you all the methods, not discuss all the methods, but because of paucity of time. So, I will not go into the traditional methods of intervention which are well known and which all textbooks will give you. So, we are not going there. So, all the speech language therapy and other kinds of therapies are there. What I will discuss in this segment is some of the recent intervention methods that have come across. So, some of them have been proposed, some are not yet attested entirely. So, some of those things let us look at. So, inherent variability across patients makes it a very serious challenge for clinical practitioners who are treating these various kinds of disorders, be it dyslexia, be it autism spectrum disorder, Down syndrome, whatever, because there is a lot of variability not only across, there is a lot of overlap across category, but within category also there is a lot of differences. So, as a result of which there are very many new kinds of intervention techniques have been proposed, and one thing to be remembered here is that all these new methods that have been proposed are used alongside the traditional intervention methods. So, alongside speech therapy, alongside occupational therapy and other therapies, these processes are also nowadays recommended. So, one of them is this is called hyperbaric oxygen therapy, HBOT. This has become quite popular recently. This is considered to alleviate the biochemical dysfunction and clinical symptoms in case of ASD specifically, but they also can be used for other problems. So, biochemical dysfunction in the brain, if you are if they have, that is kind of targeted, and as a result of the oxygen therapy they tend to report. So, there are some reports of the therapy being actually useful. So, a recent review the method reports no improvement in the core cognitive deficits with the use of HBOT, but some other studies do. This is still in a very nascent stage. It has been introduced only recently, few years back. So, obviously, you do not have a lot of data coming out from this domain, but there are some domains. So, for example, some studies do say that it does not do anything to it does not improve any of the core cognitive competence, but maybe some superficial abilities might get some impact. Overall, there is a lack of agreement. What HBOT does is basically the children will be subjected to oxygen therapy. So, they will be in a room, in a small room with into which high pressured oxygen, pure oxygen will be injected, so to say. So, the room is filled with oxygen, high pressure oxygen, and the child has to just sit there for some time, and this process goes on for a few months, and over a period of time this is supposed to interact with the dysfunction in certain kinds of biochemical dysfunction in the brain. And sometimes what happens is, in some cases of these disorders, the diagnosis would be that the brain did not receive adequate oxygen during the fetal stage, so prenatal stage. So, as a result of which, now giving oxygen out from outside may help eradicating some of the problems that the brain faced at that time. So, that is the idea. But the results of course are contradicting as of now. Some reports have suggested some positive outcome, some reports have not. There are not many negative impacts, but some studies say that there are not adequate amount of positive impact on the core cognitive competence. Another type that has been utilized for some time now is what is called educational robotics, which is in short ER. They use the social robots, and the reason for using robots in many of these cases is because it can utilize it can be utilized for multiple domains, not just one domain. So, so it can be, you can target social behavior, you can target joint attention. Joint attention is something that is seriously missing in ASD children, for example. So, with the use of a robot, that problem can be addressed. And then of course language. So, many of the studies have reported better engagement of the children, especially with ASD with humanoid robots. Due partly to the fact that robots can simplify initial interaction as well as create a predictable environment to play. Autistic children prefer predictable environment, and they also prefer to not to interact with human agents, but they can actually interact with non-human agents. So, they can spend hours playing with some toys, a particular toy or something. So, that is why educational robots can be very useful tool. And in fact, they have been used very effectively in certain cases of autism spectrum disorder specifically, and this has been found to enhance their social skills as well as joint attention skill to some extent. But again, results are mixed. Sometimes there is no positive impact, there is no direct impact, but sometimes there are. Language also can be targeted. So, because you can have a because autistic children specifically are fond of repetitive behavior. So, you can actually use certain kinds of language component that you want them to learn, and the robot can repeatedly use that, and the child can pick up. So, these are some of the domains that educational robotics are targeting at the moment. A lot of work is still going on. With respect to language abilities, the results are less problematic than other domains, because there seem to be a better outcome for language as opposed to other social skills. As I just said, because repetitive nature of the autistic children might benefit from the use of a robot in for teaching language. So, we do have some data that are pointing towards a positive outcome. Another is the idea of serious games. There are a number of serious games designed to help children learn language. Most of these games are based on the behaviorist approach of repetition and reinforcement, because that is how in order to keep their attention, because you are talking about disorder, not talking about normal children, you are talking about children with disorder. So, in that case, repetition often becomes a very useful tool. So, that is why most of these games are based on a behaviorist perspective. Often these games target a specific area of interest like empathy, emotion regulation, language and so on. Often they do report a positive outcome. There are also these are also verified through imaging studies showing greater activation in the relevant areas. So, over a period of time you also see that the activation pattern in the brain also has gone through a change in the positive direction. Interestingly, not only serious games, so these are serious games because they are designed to teach something to the children, overtly teach something to the children, but not only serious games, but entertaining games also have been found to be useful for clinical purposes. For example, action video games have been found to activate areas of the prefrontal cortex, posterior parietal cortex and temporal brain areas. So, these are areas which all the entertaining games, because in fact there is a lot of data now coming from the patient, coming from children who play video games for a longer period of time. So, it is these games actually have been found to have a spillover effect in various other domains of the brain, typically in the area of, let us say, selective attention, focusing on certain things. So, various executive function related domains have also been found to be improved in case. So, this the same can be also applied for as a therapy, for clinical purposes. And these areas are, because these areas are responsible for executive function and memory, so they can be also used and as an intervention method for those patients where these things are missing, these things are affected. So, positive results have been reported from the use of games focused on attentional training, like this is one particular methodology proposed by Spaniel et al. So, this is called computerized progressive attentional training that has been built into the entertaining games. So, this has been found to improve both emotional response and social interaction. So, this is another domain. Now, all of these games or whatever kind of newer kind of intervention methods that are coming up now, the idea is that they should be within a particular framework. Now, the potential of these serious games have not yet fully been understood or utilized for at least ASD interventions. So, cognitive constructivism and social constructivism in this domain, within the entire domain, the cognitive constructivism and social constructivism have become important areas to focus on, and based on those ideas, those theoretical positions, games can be created and implemented. Similarly, another approach which is called neuroconstructivism, that has also been proposed of late, that basic level deficits have subtle cascading effects on numerous domains over development, as a result of which this is another important theoretical domain to look at. So, interaction among genetic, cellular, neural, cognitive, behavioral and environmental level of description is what we need to take into account. So, the framework needed for serious games, as many have proposed, is this. So, the need of the hour is a mapping of game attributes on learning theories. Otherwise, until and unless you base it on a theoretical proposition, it might not really have, you might not be able to address all the relevant questions, because many of these disorders are not just a one point kind of a problem. They encompass not only language or not only one particular cognitive problem, but it is a problem that encompasses a larger area. So, neural to cellular to environmental to linguistic, all kinds of things. So, as a result of which, if these intervention methods are based on some kinds of a theoretical construct, it will be more useful. That is what the latest in the domain is discussing. So, even when the target is to teach vocabulary, it can be embedded into a context for the cascading effect on other skills, because that is what is often found in many of these, because we have talked about comorbidity in all of these cases, and how the variability within category across category overlapping makes it a very complex problem. So, the cascading effect is seen in the disorder. So, similarly, a technique that has cascading effect on other mental abilities should be in place. So, this is how the idea has been proposed. So, In case of behaviorism, you have practice drills, so reward, feedback, goals, that kind of a system. In cognitivism, you have incremental learning, motivation, attention span. These are the things that are targeted. Constructivism focuses on scaffolding, surprise, learner control, and progress. And of course, in psychology. So, depending on your goal, depending on the kind of disorder we are talking about and the kind of cascading effect that we need, we can base our theory on any of these parameters. So, this is this has been proposed by a recent study. So, broadly speaking, we have seen that there are various kinds of language disorders, developmental disorders that may co-occur with cognitive disorders, may not co-occur, but even when they are not part of another broader disorder, even then we have seen some amount of correlation with other factors might be possible, as a result of which the language related disorder or language related delays are quite common across the board in many of these disorders, and for that we need some kind of an intervention method that have been proposed based on a scaffolding theory, giving a context so that when you are teaching language using various new age intervention methods, you can also target all of these or at least few of these mental other cognitive and mental problems. So, in other words, rather than an engineering centered or a computation centered approach to create either educational robotics or serious games, we need to have these platforms as learner centered, depending on what the learner needs. So, if it is for ASD, one can create a design that is based on socio-cognitive kind of a mechanism. So, in order to make them engage with the another agent and thereby learn language. So, while you are learning language, you can also target the other EF related functions. So, while doing so, it is a good idea to try the constructivist framework for the better outcome. This is what we are arriving at, because constructivism actively takes into account, if you recall, constructivism as a theory says that the child creates knowledge, child is an active participant in knowledge creation. It is, they are not learning language as a passive observer like behaviorism proposes, or as a or just language is already there, they do not need to do anything, it is just there as an universal grammar as proposed by nativist theory. Constructivism on the other hand says that the child is an active participant in the entire process. So, the environmental input, the genetic underpinning, the the language capacity in which is inbuilt, all of that they interact with the child's agency. So, if we utilize that framework, probably intervention methods might be more useful. So, that is where we are as of today. So, as a result of which some models have been also proposed. One of them is called hierarchical computing systems model. There is a correlation between EF and language in TD children, and this is what is the this is how it is conceptualized in this model. So, as per this model, the existence of two hierarchical system, which is a habit system and a representational system, that is part of the entire mechanism. Habit system is influenced by previous experience and representational system is influenced by conscious reflection or on behavior, and this is language aided. So, these two are hierarchically arranged and compete to guide goal directed behavior. So, we have the automatic habit system is basically automatic system. The representational system is something that you that is conscious, which is the voluntary kind of processing. So, automatic and voluntary processing, they guide, they have a competition, and they try to help us with the goal directed behavior. So, language aided system may override the habit system to achieve natural goal directed behavior. So, the implication of this theory is that this model is that the interventions in one domain can improve the performance of the others. So, not only we are talking about the constructivism as a theoretical perspective, but now we also have a model that takes that perspective into account by predicting this kind of a process, that there is a habit and then there is a representational system, and in one representational system also has language as a component. So, as a result of which, if you target one component, then as a cascading effect it will improve performance in the other domains as well. This is also called spillover effect. So, thus improvement in language ability would help improve EF ability or vice versa. So, if you target the executive function related capacity, it will help with the language capacity or the other way around. So, that is what the model predicts. So, to sum up, the developmental disorders can be domain specific and affect language development only. However, newer findings do point towards that there might be more than meets the eye in that case also. On the other hand, we have there are a number of neurodevelopmental disorders that show impact on both cognitive and social and linguistic levels. So, attempt to understand and finding interventions therefore now focus on a broader level of engagements along with traditional therapies. So, this is where we sum up this module. In the next lecture, we will sum up the entire course. Thank you.